Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes. And today we have this topic. That patient has come into general practice. You are speaking to an 18-year-old boy or girl who had presented to the clinic yesterday complaining of generalized weakness, lethargy, and inability to do routine work from the previous few weeks. She also complained of breathlessness while climbing stairs for her house. तो basically patient आपके पास yesterday आया था. तो yesterday जब आपके पास patient आया था तो उसको breathlessness की problem हो रही थी stairs के time और lethargy वगैरह feel कर रहा था. So फिर अपॉन एग्जामिनेशन डॉक्टर ने कहा कि आप ब्लड टेस्ट करवाओ, जिसमें ये आया कि उसको 8 ग्राम्स पर डेसीलीटर उसका एचबी चल रहा है, नॉर्मल 11 होना चाहिए, तो मतलब बहुत ही कम एचबी था. तो डॉक्टर ने कहा कि इसको एनीमिया है. तो गिवन द फाइंडिंग्स ऑफ हर फिजिकल एग्जामिनेशन, द डॉक्टर सस्पेक्ट है, पक्का नहीं है, द पेशेंट इज एनीमिक एंड हैज आस्क्ड यू टू स्पीक टू हिम. द पेशेंट डजंट नो हर टेस्ट रिजल्ट. तो ये भी बता दिया पेशेंट डजंट नो. तो आप ये कह सकते हो गुड मॉर्निंग, माई नेम इज, अपना नाम, तो मैं अपना नाम लिख देता हूँ. माई नेम इज भूपेश, आई एम योर नर्स. तो यस्टरडे, अब कहानी को बिल्कुल प्यार से शुरू करो, कहीं से भी कर लो, चाहे आप पूरी कहानी बोल दो, पर इजी कहानी यही है. यस्टरडे डॉक्टर एडवाइज्ड यू टू अंडरगो अ टेस्ट जिसमें पाया गया इन विच तो आपकी राइटिंग में भी काम आएगा. इन विच इट वॉज फाउंड, ये पैसिव वॉइस तो हम राइटिंग में भी लगाते हैं, दैट योर एचबी इज, इन विच इट वॉज फाउंड दैट योर एचबी वॉज 8 grams per deciliter. Simple, but normal range is 11 to 16. अब इसको बस एक्सप्लेन करो. सो दिस मीन्स, देखो कितना आसानी से आप एक्सप्लेन कर सकते हो. सो दिस मीन्स दैट यू हैव लो एचबी एंड यू मे हैव या माइट हैव, मे या माइट आप लगे, जब भी प्रोबेबिलिटी होती है ना, मे और माइट वर्ड को आप यूज करोगे तो आपके लिए बहुत आसान रहेगा. यू मे हैव एनीमिया. अब ये आपकी बैकग्राउंड स्टोरी है, इसको तो आप पूरे के पूरे को पेपर में लिख ही देना. अगेन आई एम टेलिंग यू, पूरा लिख देना पेपर में. उसके बाद बस अब इसके बाद अपने रोल प्ले पे ध्यान दो. फर्स्ट पॉइंट, एक्सप्लेन दैट लोड, दैट ये फर्स्ट पॉइंट तो कवर हो गया. एनीमिया इज अ कॉमन कंडीशन, ये तो सिंपल है, तो इसमें मुझे कुछ लिखने की जरूरत नहीं है पेपर में. एनीमिया इज अ कॉमन कंडीशन and it's easily treatable. And in what happens in anemia is that, like in your case, you are having not enough hemoglobin, which is a very important component of red blood cells. अब मुझे पता ही है मेरे को बोलने में दिक्कत आएगी, या तो मैं बोलूं ही ना. मैंने आपको बताया था जो मुश्किल है उसे छोड़ दो. कल ही हमने मंत्र याद किया था, मुश्किल है तो छोड़ दो, बड़ा है तो तोड़ दो. ये थोड़ा मुश्किल है, लेकिन अगर लिखना चाहते हो तो सिर्फ ये लगाना है, विच इज इंपॉर्टेंट कंपोनेंट ऑफ आरबीसी. तो भाई ये इंपॉर्टेंट कंपोनेंट होता है आरबीसी का, तो आपकी बॉडी में ये कम है. सो बेसिकली दैट इज व्हाई यू आर हैविंग प्रॉब्लम, बिकॉज यू आर हैविंग दिस कंपोनेंट एज लो. इसके अलावा सो देयर आर ट्रीटमेंट ऑप्शंस लाइक इंक्रीजिंग द आयरन इनटेक इन योर डाइट. सो first of all you should eat like foods like red meat and steak, green leafy vegetables, fortified cereals. ऐसे एक एक पॉइंट को आप बताओगे, फिर आप एक लीफलेट दोगे, फिर पेशेंट को कहोगे आपने 4 वीक में आके अनदर ब्लड टेस्ट के लिए मिलना है. अब देखो कितना आसान, बाकी सब तो मुझे लिखने की भी जरूरत नहीं है अगर मैं प्रैक्टिस करता हूँ डेली. तो नाउ इट इज अ वेरी इजी टास्क. अब देखो, अब मैं आपको बोल के दिखाता हूँ, कल की तरह टाइम आज भी नोट कर लेते हैं. 8:49 हुए, तो लगभग मैं 9 मिनट पे शुरू कर रहा हूँ. तो 9 का मतलब है कि 10, 11, 12, 13, 14 पे मेरा खत्म होना चाहिए. ओके, मैं स्टार्ट कर रहा हूँ. 9 पे आ गई है मेरी क्लॉक. गुड मॉर्निंग, माय नेम इज भूपेश, आई एम योर नर्स. So yesterday doctor advised you to undergo a test in which it was found that your HP was 8 gram per deciliter, whereas normal range is 11 to 16 gram per deciliter. So do you know about this? Well, no nurse, I don't have idea. Okay. So doctor has told me to advise you about the same, that you are having low range of hemoglobin in your body. So after the test, it has been found that your HB is low. But nurse, I do not understand what is this HB. What does it mean that it is low? See, HB is hemoglobin is basically a very important component of our blood. It is required for the formation of RBCs. Basically, it is one of the most important component of red blood cells in our blood. So basically, the formation of blood depends upon this particular component. So in your body, it has been found low, and that is why you were having clinical symptoms like generalized weakness, lethargy, and inability to do routine work from few weeks. Am I right? Yes. Also, you complained of breathlessness while climbing stairs. So all these things, all these symptoms are happening due to your low hemoglobin level. But nurse, what should I do now? I'm really scared to hear that. Don't worry. I'm here to explain you everything. So this condition is known as anemia. So basically, when in our body there is low amount of hemoglobin, then that means that the person might have anemia. So in your case, you might have anemia. Nurse, you are making me scared. Please don't be scared. It is a kind of a common condition and is easily treatable. So there is nothing to worry. Basically, hemoglobin is made up of iron. So when we say that your hemoglobin is low, that means in your body iron intake is low. So diet is one of the most important component which can help in the formation of hemoglobin. If you will take an iron rich diet, you will have good amount of hemoglobin in your blood. So first treatment option is to increase iron intake in your food. But nurse, how would I know which foods are good? I am just about to tell you about the foods. First of all, foods like red meat, steak are very good. These are the two non-vegetarian things that you can eat, or the dishes that you can eat to increase your iron intake. Apart from these, leafy green vegetables like spinach and kale are also very good. Also, you can increase the intake of fortified cereals, iron fortified cereals. So basically the cereals which will have iron as a fortified component. So these things will help you to meet the dietary requirements. Also, we would like to fix your appointment with the dietitian for the dietary advice, as dietitian can guide you better about these things. So is it all right for you? Yes, nurse, that would be great. Okay. Apart from this, a course of iron tablets need to be taken, and also whenever you take these iron tablets, always take them after the meal to avoid the side effects. So doctor has prescribed you certain iron tablets which will help in improvement of iron in your body as quickly as possible. So is it all right for you? Well, yes, that sounds all good, nurse. Well, that's great. Also, whatever we have discussed regarding your low hemoglobin and how you can improve it, all these things are mentioned in this leaflet. This leaflet is about anemia, and it contains all the components, including the causes and how you can improve this anemia. So please try to follow this leaflet. If you have any kind of doubt regarding any of the instruction given in the leaflet, we are here to help you. Also, there is our contact number below the leaflet. You can contact on that number anytime. And last, also I am fixing your appointment after 4 weeks to come back for another blood test, because it is only after one more blood test we would be able to see your progress. So as you will increase the intake of diet rich in iron, as well as will take the iron tablets, further it is important for you to see the dietitian, and after all these things, your iron will, your hemoglobin will improve, and also it will be noticed in the another blood test. So another blood test is also required, that would be after 4 weeks. So wish you a speedy recovery, and here is your leaflet, and we'll see you after 4 weeks. Is it all good? All good, nurse. Okay, anything that I should repeat? Well, no, nurse. Okay, then take care. Thank you. That is how you speak for 5 minutes. Again, I'm telling you, we all are humans. We all are humans. We can do certain mistakes. We can we can have small pauses. We can have small hesitations in between. We can have small kinds of disturbances in between, जहाँ पे हम भूलेंगे, कुछ अटकेगा, glitches होंगे. But please don't worry, it is part of speaking. Try to speak normally. थोड़ी बहुत grammar mistake एक आधी चल जाएगी. Don't worry about grammar mistake. बट डू नॉट ब्रेक योर फ्लुएंसी। अगर थोड़ा सा पोज हो आ भी रहा है उसको दोबारा से मेंटेन करो, ये नहीं कि उसके बाद स्ट्रेस लेके तेज तेज बोलने लग जाओ, जल्दी जल्दी बोलने लग जाओ। सो मेंटेन योर कामनेस, बी very calm and composed, and do your best in speaking. This is how it goes. This is Dr. Bhupesh from Dr. BKM Institute. Our contact number is 76967342256. Thank you. Now I will take your doubts. Thank you.